Hello class, my name is Danny and this is my presentation on atrial fibrillation or AFib. Let's briefly discuss the importance of the cardiovascular system and why it's important to maintain a good functioning heart. As commonly known, the cardiovascular system is one of the most vital systems in our body as it supplies and contributes to the proper functioning of other vital organ systems such as the brain, which I will discuss further later in the presentation, the kidney, liver, and many others. One of the main functions of the heart is to ensure and maintain a normal sinus rhythm because deviating from this rhythm can negatively influence perfusion of blood into our body organs. One example of an arrhythmia is known as atrial fibrillation or AFib, which is basically a case in which the heart is not contracting rhythmically. During arrhythmia, the heart can beat either tachycardic or bradycardic. In AFib, the heart becomes tachycardic and irregular, leading the heart to quiver at the top chamber. In a normal sinus rhythm shown on the top left, or figure A, we can see that the electrical signals originate from the sinoatrial node, or SA node, to the atrioventricular node, or AV node, in an organized fashion. Because you have an organized conduction from the SA to the AV node, you will get a unified contraction of the atrial tissue. However, in AFib, shown on the lower right corner or figure B, we see that the electrical signals being sent from the SA node are in disarray or chaos. So the signals are being sent erratically and chaotically. Because you lose the unified contraction of the atria, the heart begins to spasm or quiver at the top chambers. Classically, the EKG strip for AFib is usually irregularly irregular, and we don't see a distinct P waves as we would in normal sinus rhythm because there's no unified concentric contraction of the atria, so as a result, you get these irregular patterns. So when a patient presents to the emergency room who's unstable, possibly with chest pain, pulmonary edema, hypertension, and etc., and with an EKG that shows atrial fibrillation, the patient may be cardioverted, which basically means converting the patient from arrhythmia back to normal sinus rhythm. There are indications and contraindications for this procedure. While in the emergency department, I actually got the chance to observe this, and it was quite an interesting procedure. Prior to the procedure, the patient was given metoprolol, one of the antiarrhythmic medications, and that wasn't successful. So the patient was ordered for a cardioversion. He was placed supine on the bed, connected to the IV line. The nurses attached the cardioversion pads anterolaterally on his chest and synced the patient in R waves and then given a first shock at 100 joules. If the shock does not convert the patient back, they usually tend to increase the voltage and give the patient another shock. Eventually, the patient was back to normal sinus rhythm with nice distinct P waves and carefully monitored. Sometimes the patient do not make it to the hospital before other complications arise. Remember that in AFib, the heart is not contracting rhythmically, which means blood can pool in the atria, collect, and lead to an emboli or blood clot. This clot can then travel to the brain through the carotid arteries, block blood flow and oxygen, leading to cardiovascular accident, CVA, or stroke. Therefore, patients who have AFib are sometimes placed on anticoagulants to prevent the risk of developing stroke. To conclude, atrial fibrillation or AFib is a quivering or irregular heartbeat that can lead to blood clots, stroke, or other heart-related complications. Therefore, a patient is usually given anticoagulants to prevent formation of blood clots and antiarrhythmic medications to control the heartbeat. This has been an enjoyable project and I hope you enjoyed this presentation. Thank you.